So having an implant is actually quite straightforward. You can have an implant either just with local anesthetic, as you would have like a normal filling, and it's really quite straightforward. The procedure would take about half an hour. Or if you're a little bit anxious, you can opt for, as do many patients, to be sedated. So with sedation, you're basically like half asleep, awake, time goes faster, and you're able to basically be less nervous and less anxious of actually having the dental implant procedure. It usually takes, as I said, about half an hour to an hour. And once the implant is in place, if it's a back tooth, you might then just opt to have that implant left for up to 8 weeks so that it can heal fully and integrate with your jawbone. If it's a front tooth and you need to have an implant tooth sooner, meaning if you actually need to have a crown, you don't want to walk around with a missing tooth for a long period of time, we can actually fit a temporary tooth on the implant, usually on the same day. So quite amazing, because you can kind of walk in without a tooth, and within a few hours you can actually walk out with a same day tooth. So that's the actual implant, the small screw that's gone into the bone, and then a tooth that's actually attached to that implant. It's very important, if you're thinking of having an immediate implant, is that you have to keep to soft foods. You have to be really gentle on the implant, because it needs up to 8 weeks for the actual screw to join and bind with the bone. So once the kind of surgery part is out of the way, 8 weeks it usually takes for that to heal, as I said, and you will then need to come back and see the dentist for the second treatment appointment. At this treatment appointment, you're going to need to have some impressions taken. You're going to need to have a closer shade reference match to your adjacent teeth. The dentist is going to take some impressions. They can be either standard impressions or with our new digital scan impression techniques. And these are then sent to our dental laboratory. And by the way, we have our own dental laboratories which manufacture amazing teeth and amazingly natural looking teeth that you're going to love, right? That usually takes a couple of weeks for our dental laboratory to make your tooth. And then for the final visit, the exciting part is when you actually get your finished, final, amazing looking tooth. This is tested by your dentist. Your dentist will check to make sure that it meets your expectations, that it's comfortable, and that it looks just like a natural tooth. That is usually made a little bit technical out of a material called zirconia. So it's natural, it looks just like tooth enamel, and it's super durable, and very importantly, doesn't stain. So you can still keep drinking tea, coffee, and a few other things which, you know, might stain your teeth. So yeah, once you leave the clinic, it's important that you remember that this tooth, you need to look after it. It's just like a natural tooth now. You need to brush and floss around this new implant crown that you have. And it's recommended that you come back to the dentist and see us at least once a year, just to check that everything's working well. And happy days, happy smiles, and would love to help you at our Brighton Implant Clinic.